Hello, my name is Joaquin Castillo, and today I'm going to be talking about PTSD, or post-traumatic stress disorder. First, I'm going to start by outlining the definition or the diagnostic criteria that is outlined in the DSM-5. So first, in order for somebody to meet those criteria, there must be a history of exposure to trauma or a traumatic event. And on top of that, it must meet specific stipulations and symptoms for each of the 4 clusters in 8 different areas. So there's a long list. The DSM-5 outlines that pretty well. So it'll say you must meet these, and these. So there must be intrusion, there must be avoidance, there must be negative alteration in cognition and mood, an alteration in arousal and reactivity. It also specifies the duration of the symptoms, and as well as it cannot be attributed to substance abuse or substances or a co-occurrent medical condition. So it must meet all those criteria as well as more. So the criteria for this to meet PTSD is really long, but you can access it if you look at the DSM-5. Those are just some of the main areas. So the typical age of onset, first of all, there's 2 criteria lists for children of age 6 and under. There's a certain criteria for individuals of older than 6 years old. Is the criteria that I just outlined for you. So PTSD can occur at any age beginning after the first year of life. So symptoms of PTSD usually present themselves 3 months after the traumatic event. That does not mean that they can occur before or after. So it might be a year or 7 months or 8 months after a traumatic event. Those symptoms can actually still show up after that period of time. And that's called delayed expression. And it's also outlined in the DSM-5. So when we examine what PTSD symptoms might look like in school, we notice that students might be more anxious, fearful, or worried about their safety. We might also see some changes in behavior, a lot of the time risk-taking, substance abuse, changes in academic performance, usually poor or a decrease in academic performance, decrease in attention, absenteeism, so they might not show up to school, they might be missing a lot of school, over or under reactions to loud noises, maybe a door is slamming, or the bell when the bell rings, or switching in the lights, or if there's a storm, depending on the nature of the trauma. Okay, so some accommodations that are important for teachers to know if they might have if they have a student with PTSD who's suffering from PTSD in the classroom is sometimes setting firm and inappropriate behaviors. And if an inappropriate behavior occurs, to not react by punishing the student. So not being punitive, instead of outlining potential consequences. It's important to warn students if, let's say, the teacher is doing something that's out of the ordinary, like turning off the lights if they're going to play a video or a movie, that might trigger the student. So making sure you let the student know, hey, I'm going to be turning the lights off in a few minutes. I just want to give you a heads up. That is something that is very common. As school psychologists, a recommendation, for instance, for students who are anxious before reading, if you're going to ask them to ask or answer a question in front of the classroom, that might cause anxiety or might be triggering to students, so giving them a warning beforehand is important. So maintaining a routine is also a good accommodation for students with PTSD, as this might help them get back in a routine and let them know that their life is kind of back to normal, or they can expect their life to be back to normal and not be as vigilant. So when talking to parents, I outlined a couple things in the worksheet that an example of how we might talk to a parent. It's important to define some of these terms, let them know what PTSD is, what the symptoms might look like, maybe helping them and see if we can identify some of these symptoms, not just in the school but at home. Are the parents seeing the same symptoms we are, and how can we address those things? So I found a couple helpful tips for parents that they can do at home. One of them is actually ensuring that the student gets enough sleep. So some data indicates that if students get more sleep, so 7 or 8 hours of sleep every night, that might help them to cope better with the symptoms of PTSD, as well as recover from the stress of the day. and are at the lower risk of illness. I also found that monitoring the amount of sugar intake that the students have in their diet can also be helpful. It can help to decrease stimulants like coffee or caffeine or energy drinks, and that actually might help balance their mood a little better. And when talking to teachers, it's important to first validate the fact that yes, we are seeing these behaviors, letting them know some helpful things that they can do in the classroom, as I outlined earlier, to help the student, to let them know that sometimes students might be confrontational or be acting out or acting out of character, and that might be just because of PTSD and how they're processing their trauma. So like I said before, it's important not to be punitive with the students. And again, sometimes outlining some of these symptoms and what PTSD might be. A common misconception about PTSD is that PTSD is something only that veterans or somebody who's experienced combat might be dealing with, but it could be, it could come up for a number of reasons. Trauma can be very broad. It can be very different for everybody. So that is my presentation about PTSD. Thank you very much.